Hey y'all, it's Day or De La Soul, and I'm doing part 2 to my fibroid journey. If you guys missed the first video, make sure you go and check it out. Sorry about my energy. Well, I'm not sorry, but I am pretty tired. I have low energy, but I do want to go ahead and do part 2 of this while the conversation is still going, because I feel like it was important and I do feel up to it today. I have been home now for 2 or 3 days, and things have been going great. Everything's just been going great, so I'm gonna like recap that whole day because I got a lot of questions about that on Instagram. Before I get into it, I do want to say that my channel is my channel. This is a safe place, y'all. Don't be in the comments condemning folks, arguing. I mean, you would log on and think, well, dang, what could you possibly be in the comments arguing about under a video about somebody's fibroids? But y'all, just be respectful. What I'm seeing is a lot of people are taking their own personal experiences and personal opinions, and they're condemning others based off of their one experience or their opinion. There are factors that contribute to fibroid growth. However, if you look it up anywhere, my surgeon, the nurses, the doctors will all tell you they do not know what the sole cause of fibroids are. They can tell you what they're made of, they can tell you how they grow, they can tell you how to shrink them, but they don't know what the actual cause is. They do have associations and links, but they don't know a definitive cause of fibroids. So if you are in the comments saying, well, if y'all just went on estrogen, low estrogen diets, then y'all wouldn't get fibroids. If y'all just was healthy, then y'all wouldn't. Either you know some supreme knowledge and you need to go take yourself to one of these little medical, I don't even know, researching places and submit your findings because you know something that everybody else don't know, or you just need to pipe down because everybody is different. And the example I used was there was one person in particular who was combing through the comments, and you could tell some people are like desperately looking for information because they're struggling with this. They're not being listened to by their doctors and they're having issues. So some people are desperately combing through these comments looking for stuff, and one thing that kept coming up was estrogen, your estrogen intake, and your estrogen and what is it, your progesterone balance, making sure that's balanced. So somebody was like, oh, so if I just stop eating stuff with estrogen in it, then mine should shrink. And I'm like, don't just tell that girl, yeah, stop eating stuff with estrogen. Because first of all, estrogen is healthy. We are women. Estrogen is our hormone that makes us women. That's like telling men to stop eating things with testosterone in it or do things to shrink their testosterone. That's not how it works. And my thing is too, what if that lady, you know, her fibroid growth has nothing to do with her estrogen imbalance? What if it's something different, like her BMI or something? And that's why hers grew. And she has a perfectly balanced estrogen progesterone level. I hope I'm saying that right. But what if she has a perfectly balanced one, and then she's doing all these things to deplete her estrogen, and then she gets sick? Like, be mindful. Y'all, we are not doctors. We're all just sharing information, sharing experiences. So be mindful. And with that being said, I'm going to go ahead now and hop into my personal experience and my journey and how everything went. I got what were things that I did to lead up to the surgery. I had a certain amount of vitamins I had to take. I had to take a lot of iron because I was or am anemic. I had to do iron, vitamin C. I have eczema, so my eczema was a little flared up, so I had to take a little doxycycline just for that to make sure that my skin wasn't infected. But a week before I stopped all of that, so I had like 3 or 4 weeks to prepare. Week before, they had me stop everything, no drinking, just, you know, try to stay hydrated, that type of thing, no Tylenol. They'll tell you, if you're about to have your surgery, they'll tell you exactly what to do to prepare for the surgery. I didn't do anything special other than I just tried to make sure my stress levels stayed low and stayed super hydrated, and didn't take any like supplements and vitamins or anything. And that's pretty much what I did to lead up. On a personal level, you know, I just got myself ready for work. I did all my content that I needed to do for filming, and that was pretty much it. My family, I notified just about everybody in my family, all my friends. As y'all can see, I'm very open about it. So I could have a good support system when I went home, and people are like lined up to come bring me meals, to come help me, you know, shower and all that stuff. So yeah, that's what I did to prepare for it. Actual surgery day, my surgery was at 1:30. I got to the hospital at 11:30. Everybody was real cool. My boyfriend, he walked me all the way back, and then they separated us. They gave him some information. They told me he can go ahead and leave because it was an inpatient treatment. I had a myomectomy. There are multiple procedures you can get for fibroids, and what's the best procedure is just determined based off of your situation. For me, it was a myomectomy because my fibroids were huge. I did not have any of my uterus removed. All of mine were, ooh, I can't say these words. All of mine were like pedunculated or something.
Pedunculated.
Basically, my uterus is here, right? And mine were attached to these stalks. Like, this is my uterus. It's attached to a stalk that grows out of the uterus. And they were in like a sac. That's where mine was. And I had, I guess, multiple sacs of where they were at. But yeah, I went there. Everybody was really nice. Everybody was real pleasant. Got there, had to do a urine test, make sure I wasn't pregnant or under any substances. The knockout, how I got knocked out, was pretty funny. So they came in, they're like, yeah, we're gonna give you some medicine just to, like, you know, or they're gonna put something in my IV just to, like, kind of like not sedate me, but like calm me down. I guess like anti-anxiety medicines or something. And then you're going to be wheeled into the operation room. It's going to be, they're like telling me it's going to be cold. Then we're going to put the mask on you. Then at that point, you're going to go into your sleep. We're going to tell you to count backwards from 10. Then we're going to put the breathing tube in you. Because I was completely knocked out. Like, completely knocked out. I was not awake. It was general anesthesia. Then they said they're going to put the catheter in. But they're telling me everything. And then they're like, yeah. Then after that, gonna do the surgery. You won't feel anything, you won't remember anything, and then you'll wake up in a recovery room. You spend in 2 hours in the recovery room. Then you'll be in your actual, like, recovery, like the official place where I will be in for days until I'm discharged. Y'all, I was sitting in that chair and we sitting there having a whole, I literally remember I'm sitting here with my phone in my hand, and they're like, yeah, we're about to give you something just to relax you, blah blah blah. Next thing you know, I'm done with the surgery. That's literally how it went. I don't remember going into the operation room. I don't even remember like them taking my phone off my hand. I don't remember them putting my hair into the bonnet. I don't remember none of that. I don't know if they gave me too much or they just tell you that. I don't know what happened. But I was sitting there on my phone. We keep keying and stuff. Next thing you know, I'm like, huh? Looking up, and my boyfriend like, hey. And that was it. I don't remember that 2-hour waiting room or anything. And that's how my procedure went. That whole day, from the time that I got there until, and then I think by the time I woke up, my boyfriend said it was like 7:30, 8 o'clock. The procedure itself, I don't know how long it took, but they said it was supposed to take 1.5 to 4 hours. And I don't know exactly how long it took per se, but I'm guessing, I know it was around 1:30 when they gave me the sedative or whatever it was to make me calm. And then based off me getting in the room around 7:30, I would say it took probably about the full four hours. If you take 2 hours away, that means I got to the recovery room around 5:30. So I think it took the full time, because I ended up having 18. There were 18 of them in me. And just to clarify on that, because some people were asking me, how did they miscount? How did they know that you had 18? And I know y'all just rotting for me, but I did not say there were only 18. I remember specifically saying that. She was telling me I'm gonna do a bikini cut, I'm gonna remove them, I'm gonna do da-da-da-da. And I remember specifically saying in the video that they always say that until they cut you open, they do not know exactly what's in there, because what they saw was the fibroid the size of the cantaloupe, the melon, and they saw the grapefruit one. And I haven't had a chance to sit down and talk to her in detail yet, but I don't know where those other ones were. They could have been in the sack with them, behind them. I mean, they could have been anywhere. So people were asking, how did I go from 2 to 18? I knew there were more than 2. The 2 that they were worried about and what got me hurried up and approved for the surgery and rushed in were the 2 that were that big, because they were touching on my kidney, and my kidney on my blood work was coming back with abnormal values. So I knew that there were, oh, and Daisy's back. For y'all who miss Daisy, Daisy is back. Yeah, I knew there were more than 2. I guess I didn't communicate that well, but there were more than 2. The 2 that I kept mentioning were just like abnormally big, and I'll show y'all. I got pictures of what they look like. This is it. And I'm not sure exactly what the sizes were of these, because I'm a little confused myself, and again, I need to talk to them, which I haven't had a chance to yet. But I'm assuming these are 2 different sacks, and this was the bigger sack. But you see how I got like 3 lumps in there? And I'm assuming maybe, I don't know, those 3 were in there, and then this big one had those 2 in there. I don't know, but they were in sacks, so they came out in these sacks, and I hope y'all can see this well. And then this was them once they were all out. But I knew there were more than 2. I'm sorry I didn't communicate that well. We just didn't know exactly how many. On my report it said there were numerous, and then it said there were numerous fibroid tumors in there, or myo, whatever they call them, mesias or something. And the 2 largest being that. And I'm assuming these were in sacks together and looked like ginormous ones. Like, I mean, this was the grapefruit and this was the cantaloupe. I'm not exactly sure, y'all. I'll give y'all more information on that. But there was confusion on that. But anyway, they got them all out. Since this is the show and tell portion, I'm gonna keep showing and telling. But that was my stomach before they did it, and you can see. And it's crazy because the girl that does my wax was saying, after I was telling her about it, she was like, that's crazy because I can see them in your stomach. And I was like, no. She was like, no, like legit, I can see lumps in your stomach. So I don't ask me how I did not know this was here, y'all. But that's one right there. You can see that one up there, and you can see a bump like right there. These are them. Again, I'm not sure exactly where they're positioned, what was what, but I'll keep showing y'all pictures of everything. This was them too in the sacks. Look like the sacks were connected. I have no idea what happened in there, y'all. I'm gonna tell y'all more of that part in part 3. This was them coming out. And that's my uterus, right there. I hope YouTube don't flag this video, but I don't know what's going on here, but that's them cutting me open. And I'll show y'all my stomach and stuff up close in a second. But anyway, so I woke up and I was just very tired. I don't remember a lot because, again, I was very tired. I still am on like blood transfusion risk watch. Because my hemoglobin went from like a 12 to, I think it got all the way down to like a 6. But my doctor was like, you know, she wanted to avoid doing that at all costs for reasons that me and her discussed and agreed on. Y'all, you know, keep your opinions to yourself and what you would do if you would just, like, I'm just gonna get a blood transfusion. That's you, that's your body. But I trust my doctor. We had conversations about this stuff. I'm here right now. I haven't had a blood transfusion other than me being tired all the time. It is what it is. So nurses, I know some of y'all are like, what, they shouldn't have let you leave the hospital. But it is what it is. It happened the way it happened. It worked out. So I ended up being in the hospital for 4 days, 3.5 days. Was really tired. Don't remember the first day much at all. I remember my boyfriend being there. The doctor came in, she told me all the stuff. I don't remember any of it. Like, I don't remember much of nothing. They keep saying, they told you was going to do this, and I'm like, I did. Like, I don't remember much of nothing. Hospital stay was really nice, except for until the last night. But everything was cool. They were coming in, bring me medicine every few hours. I had my little pump thing, wasn't afraid to use that. Food was decent. One thing I do want to say about food too is ever since I've had that surgery, I do not crave the things that I was craving. That first day where I was like up and kind of like, you know, up a little more, like wasn't so groggy, I wanted like french fries, I wanted like burgers and stuff. But it was like, it's like as the days have gone on, I have not wanted any of those things. All I want is like light stuff. Like, I don't want nothing heavy on my stomach. And talking to the doctor when she was talking to me about that stuff on the phone, because COVID, you know, we can't get all that one-on-one face-to-face stuff, so a lot of our stuff has been over the phone. But she was like, yeah, a lot of her patients report that after they have the surgery, they don't even want a lot of the stuff that they would eat before, because she was like, you're literally refeeding those tumors. And she was like, those tumors like make you crave high calorie things. They make you crave carbs and red beet and all that stuff. I haven't wanted, people have come by and like brought me cake and stuff. I ain't touched it. The only thing I've been like wanting is like fruits and like just vegetables and like lightweight stuff. That's all I wanted. So I'm not sure how long that's gonna stay. That could just be because, you know, my stomach has just went through a traumatic experience. But I don't crave none of that stuff now. And I mean, when I tell y'all, I used to be the type of person to eat a whole meal and then I'm like, well, I need something sweet afterwards. That was me. Like, I want seconds. Like, I have not had any of those kind of cravings or feelings or nothing. So I'm gonna jump ahead until like date where I was about to get discharged. So y'all, the night before I got discharged, let me tell y'all how somebody pulled a fire alarm in the hospital. It was so peaceful. I was getting all this one-on-one attention. My nurses was coming in, sitting with me. But that night, somebody pulled a fire alarm in the hospital. then I kept hearing like all this yelling and screaming and running back and forth all night. So that night I did not get like much of any sleep. And then when I finally did go to sleep, I slept like 5 hours, 6 hours straight, and I was not supposed to do that. Somebody's supposed to come in like every other hour to check on me and give me I had like that little thing you press for your morphine or whatever the medicine is that they give you, but somebody's supposed to come through and like administer me oral medicine because they were getting me from that to oral so I can go home. But nobody came and checked on me. I woke up that morning, I had a fever, I threw up, and I was so stiff. I mean, that was the worst I had felt when nobody came and checked on me. I don't even really fault the staff because they were so nice. They've called me multiple times since I left the hospital and apologized. They apologized to me multiple times when I was there. When my doctor showed up to check on me, she got in on them and they were apologetic. But they are short-staffed because of COVID, and that's just, it is what it is right now. But come to find out, somebody ended up pulling the alarm. I don't know who did it. It was 2 different rooms they was in there cutting up. So that last day at the hospital just really stressed me out. And I mean, like I said, I woke up with a fever. I was throwing up. I was stiff. I was hurting. I got lightheaded. Thought I was going to pass out. My fever kept coming and going for no reason. And my doctor, she was like, you know what? We had a conversation and we agreed that let's try to send you home because I live right down the street from the hospital. And she gave my boyfriend a list of things. And gave me a list of things. If these things started happening again, then I'm just gonna get readmitted to the hospital. She felt like the fever and the vomiting and stuff was coming from me being so stressed out because nothing was wrong and I should be getting better, not all of a sudden getting worse. The wound looked fine. It was no oozing, no leaking. My wound looks great. I can't wait to show y'all that. But she was like, it's gotta be stress. And she was correct. I've been home for a few days. I have not had a fever, not once. I have not felt lightheaded. I have not thrown up. I feel great. As I'm getting home, I even have more energy now. And I just set my own alarms. My boyfriend set alarms, and we've done my medicine that way. And once again, you know, everybody's gonna have their opinions. People like, they shouldn't have sent you home if you was showing a fever. But everything works out, y'all. Me and my doctor, I just trust her so much. She's guided me through this. My whole team, and that's the one thing I keep saying, because I know as a black woman how hard it is for us with doctors, but my team had my back. They advocated for me. They went to bat for me. They had my best interest in mind. So pretty much when we had conversations, they gave me all of my options, let me know the pros and cons, and we came on consensus for things, and I just felt confident. That's how I got home. Things have been great since I've been home. My family has been coming to see me, making me food. I don't eat a whole lot, but making me food. Yeah, I mean, I'm just glad to be home. I feel like everything went well. I'm really tired. And again, something wrong with my ear. I don't know if they got anything to do with anything. It didn't start until I started sitting down doing this. Maybe I've been sitting up for too long. I want to show you guys how my stomach looks. Just for reference, if you're not watching the first journey of this, my stomach was the size, or they said my uterus was the size of someone who is 6 months pregnant. And now, I'm about to show y'all. Ooh, excuse me. Yeah, my stomach is like small. Like, it's like a regular stomach. Mind you, I'm still swollen. And it's like a regular stomach. Before, y'all saw, it was like, my stomach basically poked out as far as my boobs did, if not more. I have not, I realized I have not been able to see my vagina in so long. I can see my vagina now, y'all, but it looks good. It still looks a little weird, and you can kind of see right here, y'all see that? That's where the big ones were, and you can like see where like my stomach is kind of like sunk in. So she said my stomach was gonna look weird, and y'all can see how like it's smooth right there. But right here, it's like, and it's like legit sunken in where the big fibroids were. Right here, and it's sunken in right there. Like I can press and it's like sunken in. She said it was gonna look a little weird for a while. That's to be expected, but I mean, y'all would think I've been hitting the gym the way my stomach looks. It's like super flat. Look at that. Super flat. It's crazy. And as far as my scar, hopefully YouTube doesn't flag me for this, but to be clear, my vagina is down here. It's not up here. But this is my scar. Alright, this is pretty much it up close. But I can't even really tell where the actual like scar is. And it's not as wide as this. Like there's no scar right here. There's no scar right here. And I don't know if there's a scar right there. It might start here. I'm thinking that it's from here to here, but she just got all these tapes here for whatever reason. But yeah, there's no incision right here. None. It's so smooth that I really can't tell where it is. What I'm thinking it is from right here, y'all see like that crease, to there. but it's so smooth. She did an excellent job from what I can see, because I really cannot see it. I actually had this thing initially over it, and as y'all can see, there's only blood right there. She did an excellent job, and she told me when I found her, she was like, oh, this is my thing. Like, these fibroid surgeries, this is my thing. And I mean, y'all, this is her thing, but this is really all the bleeding that I had, like, after the surgery. As far as like any kind of vaginal bleeding, again, I had no bleeding up until the day where I started getting stressed, and I have not bled at all since I was home. I've never soaked through a pad or anything. It was like spotting. It was just, it's been, she really did her thing. Like, I really could not have asked for a better procedure, especially given how big my fibroids were. I wish I could have got the little LAPA whatever thing, the laser joint where they had little incisions, but I wasn't, and I just feel like I had the best possible outcome. But I mean, I really can't, I mean, I feel like one of them people that went to Miami, like, it low-key look like I got abs, but it's really just because my skin is stretched out and my stomach has to like readjust itself to not having those there. This looks really weird, especially looking down. It's like actual like dents in my stomach, but yeah. And I almost forgot to mention like the level of care I've needed since I've been home. I need absolute care. Somebody has to help me in and out the bed. I need help with showers. I can't fix my own food. I can't carry anything over like, I think like 10 pounds. You need help. That was a question that I kept getting, like, you know, how incapacitated are you? Like, getting out the bed, and it's been a few days, getting out the bed is a struggle. Getting in and out of the bed is a struggle. I need somebody to help me up and down the stairs and all that stuff. It's not completely like, oh my God, I can't do anything. If I absolutely have to do it by myself, I will. But my boyfriend's here, my grandma's here, his mom came over. I've had friends come over. Help me. That's pretty much it for this video. I am going to do a part 3 where I talk more to my doctor. If you guys have questions, that one is going to be more like, I guess, like medical wise on like what to do to prevent them, you know, from coming back, because they can come back, and they do not always come back. I saw people in the comments saying that last video, like, there's no point getting started, they always come back. There is a 30% chance that they come back. Why? Again, they don't know, but there is a chance that they come back. But there are things you can do as far as like diet and exercises, just lifestyle changes you can make to prevent them from getting as large as mine got. And I am going to do more research on that. I am going to continue to talk about this more, because I feel like nobody talks about this, and it happened to so many. I've had so many people that I know personally reach out to me and was like, oh my God, I had fibroids and my doctor told me to not worry about them because they were small and I haven't had them checked on in years, and then I've had weight gain like you, and maybe they gotten bigger. And I'm like, I guess I need to ask these questions from my understanding, because my thing is, you know, if somebody has small fibroids and they're not having an issue, why not treat them, like immobilize them or remove them while they're small? Like, why are y'all waiting until they're presenting an issue to remove them? I really can't wrap my head around why, and I'm going to talk to my surgeon about that. She's also going to be my OBGYN, so she does surgery, she does the OBGYN thing, she does deliveries. Like, this is a superwoman, y'all. Like, I'm like, dang, can you be my primary, my therapist, my surgeon, and my OBGYN? Like, I'm sticking with that lady. But I'm gonna ask her more of those questions when I go back in. I don't understand why are we waiting until they're big and causing an issue to treat them? So I need to do some research on that and do some digging on that. But that's what I'm gonna talk more about in my next video. I want to talk more about, you know, lifestyle changes, more of the science into it, and I want to understand, why are we waiting so long? Why are we waiting until they're causing extreme discomfort, organ issues, infertility issues to get there? Because a lot of women too have to have hysterectomy or partial hysterectomy, or they're not able to have kids because of fibroids. And it makes me wonder, like, you know, if they had took them out when they were smaller, would that have caused that issue? So that's what part 3 is going to be about. If you guys have other questions related to that or information, please feel free to comment them. Once again, because I am going to be deleting and filtering and blocking people. Don't be in the comments condemning people, because I seen somebody in the comments even say something that's ignorant as, that's because black people love to eat some crab legs. Crab legs does not cause a fibroid, y'all. But keep it respectful. Keep it down to, I experienced this. This is what I think. Don't speak in definitive, because people are desperately going through comments looking for help. But that's what part 3 is going to be about. So drop your comments or your questions or information, whatever you have, so I know kind of what to ask when I go back in for my follow-up. If you guys enjoyed this video, go ahead and give me a thumbs up. If you have any other things to say in the comments, feel free to share your stories. I love reading everybody's story. In my last video I couldn't respond to everybody, but I loved reading it because it made, you know, like a sense of community kind of came about me. I didn't feel weird about it. I also feel like it removes this sense of shame about it. But yeah, go ahead, thumbs up this video if you enjoyed it. See you guys in the comments. Hit that subscribe button before you leave. Bye.